Hey, Dr. Shaw, this is my dad. So the purpose of our interview today is I want to learn from your experience that you had with your illness and how you worked with medical professionals while you were going through your treatment. So like I said, this is my dad. His name is Larry. And how old are you, Dad?
51.
51. So what is your family life? Do you live in a house? Do you have an apartment?
House with my wife and 2 children.
Okay. And how old are your children?
22 and 18.
All right. And what do you do? Do you work?
Yes.
What do you do for work?
I'm a chemical operator.
What does that entail?
That entails, actually the plant I work at, we make pearlescent pigments. We add a lot of chemicals to mica, and we make pearlescent pigments that go on car paints and cosmetics.
So is that a lot of lab work or it's a lot of manual labor?
Right now, it used to be manual. It used to be manual labor. Now it's more or less, we got a lot of robots do the work for us, so
Okay.
it's eased up some, but I mainly work in the lab.
Okay. So what is your medical history, starting with before you were diagnosed with anything? What was your previous medical history? Did you have any?
I've had gallbladder removed. I had Hodgkin's I had bladder cancer when I was 18. I had Hodgkin's lymphoma, stage 2 when I was 25. And I went through chemo and radiation for that.
Okay.
Now that here recently I've had moderate aortic stenosis, which I've had to have a valve replaced. Then after that I went to AFib. I had a couple mild strokes when I was in the hospital with the valve replacement. And then I've just now had to go back in recently for a pacemaker because my heart stopped beating twice.
Okay. So are you currently going through treatment for anything? Such as, are you going therapy for anything?
No, I'm not going through therapy for anything.
But previously you had to go through
I had to go through therapy for months.
Did you have to go through therapy for anything related to your stroke, or was it just
Well, I went
cardiac
through therapy.
after?
I went through therapy for my stroke. Actually, just hand therapy. My left hand didn't. I couldn't use everything on my left hand.
Can you use it now?
Not all the way. There are
Okay.
certain these last 2 fingers have a mind of their own at times. They get stuck in place they're supposed to get stuck in. But I work with clay, trying to roll it out. So I did have a therapist in the hospital and one come to the house after I
Okay.
for a couple of tries. They left me with material that I could use on my own.
Yeah.
To exercises for my hand.
So how long, and you said you had to go through cardiac therapy, correct?
Yes.
How long, do you know how long you did that for?
I did that for approximately, I was out of work. I had to go maybe 4 months, 3.5 months, 4 months.
Okay.
Cardiac.
So once you finished 4 months, you went back to work?
Yes, I had to go back. My time limit up was go back to work. I'm only allowed to be out of work 6 months.
Gotcha. Did you feel like you were ready to go back to work after your 6 months was up, or do you feel like you had to go back into work sooner than you were ready?
No, I felt like I was ready to go back.
I felt like you're ready to go back.
I was able to go back, put it that way.
Okay. Not necessarily ready to work, but
Yes.
able to work.
Yes.
How many medications are you on daily, approximately?
Approximately, I take
Different types, maybe not how many.
different
pills.
types, but I probably take 13, 14 pills a day.
Okay, and that's covering. Are you on blood thinner?
I'm on blood thinner. I'm on stuff for blood sugar, something for cholesterol. I take 4 aspirin a day for my heart.
Okay. Are you on any diabetic medication?
Yes, diabetic for blood sugar. That's yes.
Okay, and then are you just on a pill, or do you have to do insulin as well?
I'm on a pill.
Just a pill. Okay. So, how long ago did you have surgery for your mild aortic stenosis?
You were graduating. No. 14. Somewhere between 215, 26, somewhere in there.
So 3 years ago.
Something like that.
Okay. And how do you feel now?
How do I feel now?
Mm-hmm.
I don't have the stamina that I had before.
Before surgery?
Before surgery. I felt like I could do more. I can't. My heat kills me. I don't like this heat.
Do you feel like you can do inside work or just outside work bothers you?
I don't think I'm where I used to be.
Okay.
I don't think I'm at all where I used to be. I think I'm. I just can't. I get the shortest breath, more so than I did before.
Do you feel like the pacemaker helped or hasn't helped that much?
Well, the pacemaker's helped with the fact that I haven't passed out twice. My heart hasn't stopped twice.
Okay.
There's now, I know the pacemaker doing what it's supposed to, but at times, when it goes from 60 to 120 and 130 pretty quickly, where the pacemaker's working with what it's supposed to do, it makes me feel funny. Just don't feel right. Not any pain or anything. I just don't
feel like you used to.
Yeah, I feel dizzy or just something just don't feel right.
Yeah. Okay. So do you think that's one of your main short-term complications from your surgery is having to get the pacemaker and?
Well, definitely. Right after I got the pacemaker, they had me all messed up.
Did they?
Oh yes. They had. Well, after I got the aortic, my heart wasn't beating right, so they had to go in and do the ablation. So they're either going to shock the heart or shock the heart back in where they're beating together, or go in and burn something. And they went in and decided to go in and burn something to make our hearts beat the same. But ever since then, I just haven't been, not like I used to be in the past before. I just think there was nothing wrong, but I don't know, like no stamina whatsoever. I can't work out in this heat.
Yeah. So you feel like, do you have any other long-term complications besides not being able to produce the amount of work you used to before? Like, I know earlier you mentioned your fingers. Anything else that you can think of?
Yes. Well, with the pacemaker, I'm limited on what I can do based on being around the plant I work at. I'm not supposed to be around magnets. Yeah, it's limited me on. I got to pay more close attention to electric fields, motors. See, at work I'm supposed to be able to change motors and stuff like that, and be around. I'm around a whole bunch of electric equipment. Mm-hmm. Actually, it's not supposed to be. If you read a book, you're not supposed to be close to it.
Right.
But actually, if you get further into it, don't actually touch. Don't sit it on your chest.
Right.
Like a cell phone. You're never supposed to sit your cell phone where the pacemaker's at. It will mess things up.
Okay.
So yeah, that has limited me on thinking, saying, put more thought into where I'm at, what's going on around me before I do something.
Does it make you more anxious depending on where you go, worrying about things around you in your environment? Like when you travel, are you more worried about having to go through security or?
Well, I'm not worried about it. I just I advise them when I fly that I do have a pacemaker, and I can't go through that. I can't be wanted down or nothing like that.
No issues with that?
No, they just put me to the side and pat me down.
Gotcha. Well, that's good. I want to talk about how you felt going through this whole process. So you had some complications while you were in the hospital. How did you feel while you were in the hospital? Did you feel like you were recovering, or you just felt sluggish all the time, or you were just ready to get out of there? And how did you feel once you came home and going through rehab?
Well, I didn't know it was that bad. I don't know, the cardiologist said he's looking for a number to do this. I didn't know I even had a heart murmur or even had a bad valve.
Okay.
Until my company doctor found it. And I just had to be going through all this chemo, radiation,
right.
Cancer. Doctors are seeing me. There are people that are constantly taking blood from me and listening to me, and nobody ever said anything about a heart murmur. And finally at work, maybe, I don't know how long ago it was. It's been 5 years, 6, 7 years ago, they heard a heart murmur. I've been there over 20 years. And my company doctor goes, "You got a heart murmur." And from there, I went to my regular doctor, and he's like, "Yeah, you do." And he never heard it. And then, next thing you know, 5 years later, I'm having a valve replaced because bad valve, based on from a heart murmur. It went quick. Mm-hmm. And so I wasn't prepared for that. It scared me. And then after we got in the hospital, after the maiden surgery, and I know I was not a good patient in the hospital. I was sort of mean. I was mean to everybody. I was mean to nurses. I was short.
You were frustrated through the whole process?
I'm not frustrated. I'm just when I don't feel good, and I don't like, I'm mean, and I'm just mean. Yeah. And I say things that I regret later. But second time I went in after I got out and I couldn't do anything really because my stamina was really bad.
Why did you go in the second time?
The kind of found out my heart was not, one chamber was beating different faster than the other.
Okay.
They were fighting against themselves. So I was going to go ahead and have the ablation. I was really scared that time.
Yeah.
In fact, we had a nurse that I talked to. We had a nurse come back. I mean, me and your mom. I had a nurse come back to the room after her shift, talk to her. Not as just her advice.
Yeah.
We found one we really liked.
Yeah.
And talked to her about it and asked, what would she do, ins and outs. Forget about that. Forget about what the doctor says. Or just talk to me, you know? Right. And she explained things to us and made it better for us to feel more comfortable doing it. Okay. Because the doctor's like, you need to do it. You know, I don't know. I like what she said, and me and your mama went off of it because we didn't know what to do.
Did you ever feel uncomfortable coming home, like you weren't ready and you were scared to leave the monitors from the hospital, or you were just ready to get out of there? I didn't feel anything.
I didn't feel anything before I went in. I didn't feel anything when I went out. I didn't know I had a heart valve. I couldn't tell me I had a heart valve. I was in no pain, no nothing. They just said I need a valve replaced.
Okay. So none of that made you nervous or anything? When you started rehab, how long was it before you could start rehab after your surgery? Do you remember?
A couple weeks. I can't remember exactly. You remember exactly how long he said you can start rehab.
Okay. Were you ready to start it? Were you anxious to start it? Or you really just wanted to do nothing at all?
Be honest with you? No, I didn't want it. I didn't want to start rehab. Because rehab, I'm riding the bicycle or I'm just, you know, and these ladies are looking at me and it's just riding a bicycle. I didn't.
Right.
I know it's, I'm supposed to do it, but.
Did you feel comfortable in your rehab environment?
Yeah. Oh, yeah.
Yeah.
Comfortable with
they made you feel comfortable? Good.
Yeah. No, they didn't either. They held me the whole time over my bad habits. Because I had to go through nutrition class.
And they changed it all.
I had to take classes. I didn't take classes when I went through rehab.
Yeah.
They stopped the class. You had to go to nutrition class or some class where they went over how to eat and what to eat, what not to eat, and all that kind of good stuff.
Yeah.
Bad stuff, I should say.
So do you think those classes impacted you at all, or have your habits not changed very much?
Well, I stopped drinking dark soda with the...
What? Hey,
it's clear soda.
That's a change. That's a change. Do you feel like your illness impacted your environment? I know you said before work's a little different for you, and you've switched from working in where all the big machines are.
Well, my team. I work with a bunch of guys. There's no supervisor on my team. We don't have a supervisor. We're team-oriented guidance. They just allow me to work the lab, and when things get hectic, they look out for me. It's a bunch of great guys.
Okay.
So I'm supposed to be out in the plant working, but they take care of me a little bit.
All right. What about your home environment?
If I can get you to do more things, it'd be better. I don't mow the yard. I haven't mowed the yard in 4 years. So I got somebody mowing the yard. So like I said, heat kills me. I can't.
Yeah.
I can't. I can only do what I can do. I can shortness of breath.
Yeah.
It just, I don't know. Maybe that's the way it should be. Not the way it should be. Maybe that's the way it's going to be. I don't know if it's going to get better. It ain't going to get better, but I'm sure if I lost weight and did what the doctor said I was supposed to do, things might be better. Maybe just a little bit.
Do you feel like your environment has impacted your illness? So by that I mean, like, do you feel like work makes the stress in your life higher, so it puts more stress on your heart, or do you feel like your home life has affected your
I don't know. I really don't know what stress is. I know your mother talks about stress. I don't know what stress is.
Okay.
I can go to bed anytime. I don't know what stress. I really don't. I don't know what stress is. I really don't.
Well,
I mean,
everyone deals with it in their own way.
I don't know what it is.
Yeah.
I mean, I can't tell you where I don't know how to explain what stress is. I really don't.
Well,
I'm not worried about anything. I come home, go to work. I'm here. Everybody's here. I don't. I worry about when you leave. We call that stress. Somebody leaves and they're not here. Maybe that is stress, but I'm not really stressing over it.
Well, that's good. Did your illness challenge expectations of your caregivers? So, I mean, like, since your illness came from something else, like, because they said the chemo was possibly an indicator for where it came from and weakened your heart.
Yes.
Do you think your family expectations or your healthcare providers' expectations for your recovery affected or gave you any extra challenges at home in your environment? Do you understand what I'm asking?
Yeah, y'all kept telling me I was eating the wrong stuff or doing the wrong things. So yeah.
Okay. So it made challenge you a little bit.
That's where stress comes from.
That's where stress is.
That's where my stress is at.
That's it right there.
Yes.
Okay. All right then. I stress out my dad.
Yes.
All right. Did you feel like there was anyone or any program at the hospital you had your surgery at had that particularly helped you in your recovery? So did you have any like pre-surgery classes to help you understand what you would be going through in this hospital, or was there any? I know you mentioned that nurse before when you went back. Was there anyone else that particularly helped you throughout the process you can remember, or you were completely unsatisfied with your care?
No, that's the only nurse that made an impression on me and your mother out of all the nurses, because I was in the hospital
3 times.
3 times.
At least.
So I don't. That was the only one that made an impression to where we could talk to her, and she would just want somebody to come in and take your vitals and or give you whatever medicine and walked out the door. She's the only one. I had personal talks with some doctors, especially one that came in with they brought in a neurosurgeon for when I set up at the strokes.
Mm-hmm.
He came in and I could talk to him.
Okay.
You know, more than just a doctor, but patient words on my head. It was more, him. I had a pretty good relationship with. The rest of them, it was just professional, just a doctor patient. No conversing, no extra words need to be said or said.
Do you think that did the lack of relationship being built hinder your comfort with being able to ask questions with those other physicians?
No. If I had a question to ask, or your mother did, we asked. We made sure the question.
Okay.
We found somebody to find us the answer to that question. Yeah.
Do you feel like any one of those, a physician, a nurse, or a therapist, really made a difference in your outcome, or they all were just good doctors, got you in, got you out?
Well, they're good doctors. I mean, but as far as...
Did anyone really stand out and feel like you made your recovery not faster, but you had a better recovery because of this nurse that helped you out?
Well, that nurse the second time, just the second time. Yeah. I made sure when I saw her, we wanted to bring her, when I got out of the hospital that week, we wanted to thank her. Mm-hmm. And the hospital said we couldn't do that. We're not allowed. Oh. We're not allowed to thank the individual. Now, if we want to bring stuff for all the nurses, that would be fine. Oh. But we can't individualize one nurse. But for her, it was just a personal,
Gotcha.
Just personal thing.
Gotcha. Well, thank you.
Well, thank you.